Hi, my name is Peter Chirico at Chirico Physical Therapy and Wellness, and today I wanted to talk to you about best treatment approaches for common shoulder pain problems. And this is essentially if you're struggling with shoulder pain, either from an old injury or a current one, and this could be for an athlete, someone who's very fit or active, somebody who's a weekend warrior, or even a secretary who isn't that active but does have a shoulder problem from degenerative changes which can occur and from prolonged postural positions or activities that we're in a lot today. The important thing to understand with all of this is that we need to find the root cause of the problem, what really is causing the pain. And we don't want to waste your time or our time with chasing the effect and not the cause, and not getting a good result and having things reoccur and prolonged any more than necessary. A good analogy of this is if there's a fire in your house, and you hear the fire alarm go off, the first thing that you do is get up and go and find out where the fire is and put it out. And then later on after that, you'll go over and shut the alarm off. Well, the body works the same way. Where you feel pain is your body telling you there's a problem somewhere. It's the effect, but not the cause. It's not necessarily coming from where you feel the pain. So what's important here is that we work together to try to solve this problem of really where the pain is coming from. And it can be very deceiving. So it's important, though, because we want to have the best outcome for you, and that's what's most important. So let's take a little time just to go over the different types of shoulder problems, and there are many. There's muscular strains that can last 2 or 3 or 4 weeks. There's ligamentous strains that can last 2 or 3 or 4 months. There's tendonitis that can occur at a certain point in the range of motion. There's bursitis that can hurt at any point in the range of motion. There's things like rotator cuff syndrome, impingement syndrome, frozen shoulders, small and large rotator cuff tears. You can have referred pain from the cervical spine area that just feels like it's in the shoulder and can fool everybody. The same thing for what's called thoracic outlet syndrome, which is even more difficult to try to diagnose. But I've seen all of these, and we've had good results, very good results with shoulder patients. And I've also had shoulder problems myself, and maybe that's part of it. I understand where people are coming from. I've had unfortunately, I had a large rotator cuff tear on my right shoulder, and had to have surgery for that. And I had a chronic bursitis in the left shoulder that just wouldn't go away, that had to have surgery for it. So I understand where you're coming from, and we don't want it to last any longer than necessary. So to recap here, it's important that we find out what is the problem, because the best treatment approach is based on knowing what the real root cause of the problem is. Because not all shoulder pain is alike. As you can see, there's many different causes and possibilities. So unfortunately today what happens is people will go in and get standard care, and standard care today has deteriorated so much that you're lucky if you see your therapist more than once every 2 or 3 or 4 weeks, and if it's even the same therapist. On top of that, you're treated by unlicensed techs and aides, and you're just not monitored closely enough. And unfortunately, people don't get good results, and things reoccur, or they're prolonged much longer than necessary. So I hope that's not you. And but if you are having shoulder pain problems, we can help you. Please give us a call. We're more than happy to help you, talk to you in any way we can. My phone number is area code 909-345-3370, or you can email me at pcpt, the letter N, and wellness@gmail.com. Well, I want to thank you for your time, and I hope this video has been helpful to you, and I want to wish you a good day. Thank you. Goodbye.